Hey everyone, it is SoFab Kimberly from TDS Radio, and this year the Lung Cancer Initiative is participating in the National Black Family Cancer Awareness Initiative. And I am truly honored to be leading this discussion with Dr. Hiren Mehta. He is a pulmonologist at the Rex Hospital, pulmonary, and board member for the Lung Cancer Initiative. Now, I recently lost my mother to non smokers' lung cancer. And unfortunately, when found, it had already advanced to stage 4. So today, we'll be talking about raising awareness and how to improve access to screening in our community. So, welcome, Dr. Mehta. Thank you for joining us.
Thank you so much. This is so important, and it's a super important topic to me personally. I think to you now, you realize the discussion needs to be there with us and everybody in our communities as well.
Let's jump right into it. And one of the main questions I think a lot of people want to know is provide an overview of lung cancer, and some of the risk factors of lung cancer, and then what are the risk factors for Black families?
Yeah, these are all great questions. So, lung cancer. I think a lot of us have heard the term lung cancer, some misconceptions, definitely all fears. You hear the word lung cancer, you instantly you kind of associate it with dying and mortality, and you'll hear that term quite a bit today throughout, just to help me describe the effect of lung cancer, right? So lung cancer, it's a big killer. That's the one thing I want everybody to take away from here. It is why that we associate lung cancer with death, because it's true. So I'll give you some perspective. So lung cancer kills more men than prostate, colon, and pancreas together combined.
Wow.
Lung cancer, this is even more alarming. Lung cancer kills more women than all cancers combined.
Wow.
That is the impact you're talking about when you're saying how big is lung cancer. It's big. So to put it in perspective, it kills a 747 plane full of people every day. So every day a 747 plane dies filled with people from lung cancer. And that's why we're sitting here having these discussions. And that's why it's so important for us to find a way to prevent it.
Absolutely.
So one of the biggest associations in our mind is smoking, right? It's always been associated with smoking, and there's good reason. 80% of lung cancer is in smokers. So then again, obviously we'll think about smoking, but just like you said, 20% happens in non-smokers, and we can't forget that group because it's still a big number. And 20% of those people, there are risk factors, like we talked about, that aren't smoking. So number 2 on that list, second to smoking, is radon. So everyone here listening has to know that radon's a gas. It puts you at high risk for lung cancer. It's something that's found in soil. So if you've ever bought a home or you have a basement, you'll get home inspections as part of your purchase of a home or a rental of a home. They'll do an inspection for radon. And if they're not, they should, because now it's so important that if your family is going to live in the bottom floor or a basement or, buying a new home, that's the first question you want to ask after how much is the house. But is the radon been inspected and all of that? And that's important. And then the other risk factors you want to think about is asbestos exposure, secondhand exposure, right? Like, you may not smoke, but if all your family members are smoking, you better believe your risk of lung cancer goes up. And then just air pollution or, in general pollution and all that puts us at risk of cancer in general. So that's that 20%. I believe your second question is, how does this impact your community?
Absolutely.
Black America, African American community has, and this is so important. I think, like many other conditions, there is a systemic disparity in populations, in cultures and everything, and races. And it's important to recognize that. It's important to understand it, but then it's more important to do something about it.
Absolutely.
And that's where this is so important for you guys. And I'm going to throw out some facts for you guys, but initially I want you to understand that lung cancer has a clear disparity. and it has to get narrowed down. There's a disparity in lung cancer incidence. How frequent does African American population get lung cancer over a white population? Mortality, there's a difference. Screening, lung cancer screening, there's a difference. Treatment, there's a difference, and it's alarming. And I'm going to go over all of that. But one of the questions a lot of people have is, well, why the disparity? Why is there such a disparity amongst these people? And I think it speaks to just a large difference in socioeconomic access to healthcare, trust in healthcare, lack of education or resources. Those all have to be real. You know, in Lung Cancer Initiative, we talk about we have a great stronghold in the main cities, but a lot of times we have to do better getting out to smaller communities, getting out and educating the communities, and we don't do that as much. And this is where, over years, you start growing that difference and those disparities, and then you get these alarming numbers. And as your listeners are listening to this, these are the numbers I want people to hear. I mean, you hear percentages and data and all of that all the time, but these are pretty significant when you're talking about mortality, like we were talking about, meaning it kills more people than most cancers, both men and women. These numbers matter. So 15%, so African Americans are 15% less likely to be diagnosed early. That means almost 15% of the time you're going to be diagnosed late stage. It matters. When you find lung cancer and where you find it, it really impacts your mortality. We know that currently most lung cancer we find is late stage, meaning stage 3 and 4. 80% of lung cancer is found in stage 3 and 4, which is a high mortality. With screening, and which you and I will get into screening, we can shift that. We've shown that with screening, we can change that to 80% found in early stages, 1 and 2. That completely flips the script here, you know? But for African Americans currently right now, even with those abysmal numbers, 80% are found in 3rd and 4th stages, 15% of the time, it even impacts African Americans worse. So then you are 11% more likely to be diagnosed with lung cancer. So there's an 11% chance higher of getting lung cancer. Once you have cancer, let's say access to care, you'd think, well, once I get a diagnosis, the treatment should follow the same track. It shouldn't matter, right? It matters. 19%, almost a fifth of people are less likely to receive surgical services. African American, that's so critical. Surgery, resection, cutting a cancer out is the gold standard. It is a curative approach. It actually changes and improves your prognosis. So when you're talking about 1 in 5 people, or African American people, don't have access to that surgery, that's huge. And then even more alarming to me personally is 10% are more likely to not receive any treatment. That means 1 in 10 that get a diagnosis of lung cancer don't even get treatment. That's a straight mortality. That's not even a fighting chance, right? And so lastly, one of my bigger things is, so 10 to 12% higher mortality, 5-year mortality. That's how we look at lung cancer or cancer sometimes in general, is your 5-year survival, right? And it's 10 to 12% higher mortality. You're more likely to die if you're an African American, and you can tell why. We talked about not having access to surgery, not getting any treatment, finding it later than our white Americans, and having a higher incidence of lung cancer in general. So this is why it impacts you. This is why we have to get out and we have to talk about it. If a family or a friend smokes, you need to explain to them some of this information. It's your responsibility. Healthcare providers aren't always going to be there. Church leaders aren't always going to be able to do it. You have to be able to tell a family member, hey, you smoke. I heard a talk. you're at really high risk for lung cancer. Our community is at a high risk. You
Mhm.
should consider being screened, and that's why it's important.
Absolutely. And to definitely highlight what you had mentioned earlier is just the fear of seeking out a professional, or just professional help in general, because it's like if I go to the doctor, I'm going to hear bad news. And instead of thinking I'm going to the doctor, I'm at a stage where we could possibly prevent, the upcoming stages of what's going to happen as far as chemotherapy, radiation, or even as you said, can't be treated because it's so far advanced that now you're preparing your loved one for hospice. And it's a horrible feeling where instead of us being reactive all the time, it's time to start being proactive.
Oh yeah.
So taking those steps and talking to your healthcare provider and really talking about screening, which is something that we're going to get into. And the question that I have for you, as far as what does it look like, and who actually is eligible?
Right. Yeah. So screening is important. So if you take anything away from my talk today, it's screening, right? Because all the numbers I provided, the take home is that lung cancer is bad, but screening is the most important takeaway here, because this is what saves lives, right? We know it's a big problem, but how do we solve that problem? And this is the first fix. So just like you said, it was awesome. People fear chemo and people fear radiation, and I don't blame them. My mom was diagnosed with breast cancer. Knowing what I know, I was still just shook with fear. It's reasonable, but screening is where you get proactive, where you don't even have to experience a lot of those emotions, because we can get on it early. We can prevent it from getting into late stages where you're even discussing chemotherapies. And that's why it's important. So that's why this take home is going to be very important. So screening, actually, believe it or not, is very new. It's essentially close to just 10 years old. We didn't have screening before. There was several studies done over the last 50 years on lung cancer screening, none that was real fruitful. That when you're looking at screening, what you're looking at is, does it decrease mortality? Does it benefit our general population as a whole? And does it decrease mortality by screening people? And so none of those studies over the last 50 years showed that until 2014. There was we call it the NSLT trial, right? It was a trial here in America, huge study that looked at smoking screening with a low dose lung cancer screening CT, right? So that's a CAT scan. That's a very specific image of the lungs that gives you detailed pictures. But what they did was, which was really good, they reduced the amount of radiation they gave you, because they realized that even at low doses of radiation, they can pick up small spots in the lung. So that's when they said, well, hey, look, why don't we use that and compare it to a chest x-ray, which is what we've always used in the past, is using chest x-rays to look for lung cancer. They were able to pick up so many more smaller nodules on a CT scan, because the images were better than a chest x-ray, and realized we were missing so many nodules. They were actually able to show that with screening using a low dose radiation CT scan, they were able to reduce mortality by 20%.
Wow.
They were able to save in 1 in 5 people's lives by just screening. By just doing a CT scan once a year, they were able to save 20% of lives, right? So that's a huge impact when you're talking about big numbers, like when we're talking about lung cancer mortality numbers. So that in itself was a great study. It really helped identify screening is important. So then in 2018, we have the United States has a preventative task force. They look at all this data and they come up with guidelines. They're not insurance. You know how insurance sometimes can be prohibitive in terms of providing good health care, because it costs them to provide good health care. But this is one that looks out for the people and looks behind the studies. And they were able to say, look, based on this study, lung cancer screening is important. And they set out some guidelines. It took many years to get the insurance companies to buy into this, but by 2018, they published their guidelines, and insurance companies started covering lung cancer screening. This was a huge milestone. And if you think about it, that's not a long time ago. That was 5 years ago that they did this. So you're not talking about a long time ago. So now that study comes out. Then a second study comes out of Europe. It's called the Nelson trial. That was just as good as the initial NSLT in showing a reduction in mortality.
Mm-hmm.
It again showed if we screen people, it reduces mortality. People live if we find it early. And that's what screening does for us, for any type of cancer.
Mm-hmm.
So now after these two trials came out, there was no question screening was important. What's more important for the Black American community is that in 2021, they actually changed the guidelines, okay? They changed the guidelines to the current guidelines, which I'm going to give you. And if anybody's listening, I would write it down, or just remember, if you smoke and you want to ask any provider about screening, and they can give you this information. But so there's 3 components to screening, okay? There is your age.
Mm-hmm.
So the age is age 50 to 80. If you're anywhere between 50 years old to 80 years old, you should be screened.
Mm-hmm.
And you're a smoker. Now, this is a bit tricky because this requires a little math, but what they say is 20 pack year. They talk in terms of pack year. It's not how much you smoke day to day, but it's a calculated number. And those that love math, the way we calculate it is that you take how many packs you smoke and multiply it by how many years you've been smoking, right?
Mm-hmm.
So let's say I smoke 1 pack of cigarette a day for 20 years. That's 1 times 20. That's 20 pack years.
Mm-hmm.
Okay? If you ever have a trouble with that, you can Google it, or you can just ask a provider. I always tell people, if you smoke, you should bring up lung cancer screening. It's not up to you to do all the math and know the criteria. It's just up to you to bring it up to a provider so they can give you the information, right? So age 50 to 80, 15 or 20 pack years smoking history, and then quit within 15 years.
Mm-hmm.
That means even if you've quit 8 years ago, you still get screened. Even if you quit 10 years ago, you get screened. Even if you quit 12 years ago, you get screened. You get screened until you've quit for 15 years total.
Wow.
This is important because a lot of times people are like, "Oh, I quit 5 years ago. I'm good. I shouldn't get lung cancer. I quit years ago." 15 years. So you still should get screened if you've quit within 15 years.
Absolutely.
Right? So those are the 3 big criteria: age 50 to 80, 20 pack years smoking, and quit within 15 years. So if you quit within 15 years, you still get screened. After that, you can stop getting screened.
Awesome. So then let's talk about the number who are non-smokers, who might not fit into that age group or do,
Right.
or who honestly aren't showing any signs. What is the advice that you can offer to them as far as preventative care, or even just screening? Can they talk to their healthcare professional just to say, well, I would like to just be screened just in case?
So unfortunately, these guidelines fall short of that. In fact, I'll take it a step further. They fall in short of people who are non-smokers, but they also fall short in terms of secondhand smoking, right? You notice I didn't mention anything about secondhand smoking, unfortunately, but you got people who sat in that same house for 60 years while their spouse smoked, and they don't get screening. And unfortunately, it's the same answer to those that are the non-smokers. There is no qualified screening test yet for that.
Mm-hmm.
And it's unfortunate, but one of the things you can do is look at the risk factors. We talked about radon,
Mm-hmm.
asbestos, environmental exposures, chemical exposures. Look at the job you do. Does the job you do put you at high risk for respiratory problems? Those people probably should be talking to their providers. Hey, I work in this community, this job. I breathe in all this dirty smoke all the time. Should I be at least getting a chest x-ray, or should I be talking about a CAT scan? And you can get in those discussions, but right now there is no screening or qualified screening guidelines for those folks,
Mm-hmm.
unfortunately.
And then for people who may fit into those guidelines, but aren't showing any signs, are there any signs to even look for? Because I
Yeah.
know for my mom, one of the things that kind of sound the alarm for us was that her breathing became compromised, but by
Yeah.
that time, as I mentioned, it was too late. So are there any subtle signs in the beginning that someone should pay attention to that should make them say, okay, I think I need to talk to someone, or I think I need to go ahead and get the screening
Yeah.
to see what's happening?
So one of the most common causes or common symptoms, which are very non-specific, I have to say here. I don't want everybody who has a cough or shortness of breath run out and say I have lung cancer. That's important to remember. Don't do that. I'm going to get all these providers calling me saying, "What are you doing?"
So,
But a nagging cough that doesn't resolve after several weeks or months needs a chest X-ray. You would be surprised how many times I have patients come to my office who have had a cough for 8 months and didn't even see a provider. They didn't even see a primary care doctor to discuss this. They blew it off to allergies, or they blew it off to acid reflux, whatever it is. But it's important. If you're coughing or you're short of breath and that's not your baseline and you've been doing it for several weeks and you don't have a reason, you need to be seeing a provider. And you should bring up to that provider, should I be getting a chest x-ray, at least to start with? Then you can consider a CAT scan. But those are things that you need to do. So a couple other symptoms, so instead, cough, shortness of breath, coughing up blood. That's a red flag sign, right? You cough up blood, you need to seek some support, right? Weight loss, unexplained weight loss, that needs to be addressed. So some of those are good reasons to go and see a provider. Even
absolutely.
though they seem non-specific at times, if they're persistent and not going away, they need to be talked about.
Absolutely. Absolutely. And one of the other things you mentioned, just as far as next steps and moving forward, because we are starting to have these conversations more and more, which is extremely important when it comes to the Black
Yeah,
community. But as you mentioned, we also need to do our part. We have to start talking to our healthcare professionals. We have to start, going to get our physicals, blood works, or screenings, whatever have you, especially depending on where you are age wise and health wise.
yeah,
Because I definitely can say I am so tired of having the talks of, now what do you do once it's too late, instead of, okay, we found this just in enough time. So now we can do this and we can work on things, to extend the person's, life. Um, so now what are next steps? We mentioned possibly, well, not possibly, we mentioned we need to start holding others accountable. We have to start having
yeah.
these conversations. What
That's
else
right.
can we do?
So I think that's the biggest thing. So let's say you're listening to this talk and you find it moving and you think it's important that others learn about it. Bring it up at community centers. Bring it up at church. Say, hey, you know what? I'd like to do a 15-20 minute talk about if you're smoking, you really need to go get cancer screening. It has to come from within our community. Doctors aren't going to sit there and come to church to explain it to people, and it's important for you to go up to your doctors and say, hey, I smoke, should I be screened? You would be surprised. Not all providers know the guidelines, screening guidelines. And remember, it's new, right?
Mhm.
So this is recent stuff, so not everybody knows that. So you can inform everybody around you, but for yourself, personal responsibility, you smoke. If something I said today is personal to you and you connect with some of that, you need to be talking to a provider to be at least getting a chest x-ray, if not getting screening done. And as a whole, we have to improve screening, so I'll tell you right now, colon cancer and breast cancer screening, most of us are familiar with that.
Mhm.
The North Carolina screening for colon and breast, or even national numbers, roughly around 75% or more. So patients who should be screened, 75% of them are being screened. That's a good number. Three-fourths
Yes.
of patients who should be screened are being screened. For lung cancer, in perspective, North Carolina, our number is 8%.
Wow.
Yeah,
Wow.
that's that's where we're at right now, is 8%. So you're
Mhm.
looking at colon and breast cancer getting screened, but lung cancer is 8% stagnant right now. And
Mhm.
that's why it's important that we discuss these things and personal responsibility in terms of just taking our health into our hands, not letting fear prevent us from getting good care, not letting our race or color do that. Then you let others win when you do that. It's important for you to say your life matters and you should be getting screened. You should be seeking help. You should be getting the appropriate care you deserve.
Absolutely. Absolutely. And I know that a lot of information was shared today, a lot of very, very useful information. So for those of you who, are possibly concerned, you may have heard something that may be ringing a bell with you, or, you are a smoker. This is definitely something to where it's time for you to take the next steps. It's time for you to educate yourself more. It's time for you to talk to a professional. And if they want to learn more, or even if they want to learn more about the screening and processes and things like that, where is the best source of information?
So, at Lung Cancer Initiative, we always talk about this. It's a bit of my pet peeve. So I see a lot of lung cancer patients. It's one of the things I do. And, if somebody has an abnormal scan, I see a lot of those, right? The problem is sources and resources are very scary. What you read and where you read it worries me sometimes, because I see people get so much misinformation and they come in with tears and crying, and it's because they got their information from a wrong place. So I always tell Lung Cancer Initiative, for those you don't know, Lung Cancer Initiative is the North Carolina's biggest advocacy group for lung cancer. It's for patients, but it's for patients and their families, right? So you're a concerned family or a spouse. I say go to our website, lungcancerinitiative.org. Get on there, look for resources. And it's not just medical jargon, right? You're talking to people, or you're hearing testimonials from people that have been through it, from just smoking, cessation, like how to quit smoking, to getting diagnosed with lung cancer, and that journey you take. There's a lot of support. That's the first place I try to get people to go to first and talk about that, and start looking at the right resources.
Absolutely. And I'm so glad you mentioned that, because as you mentioned, there's a lot of misinformation out here, and a lot of things that are clickbait and scare tactics. So it's very important that you're going to the right resources to gain that information. So Dr. Mehta, this has been eye-opening, and I appreciate your time so much. I hope this isn't the last time that we speak.
No, I'd love to come back and talk about any one of pulmonary problems. You got asthma, COPD, lung cancer, anything. There's a lot of awareness that we all need to teach each other, and it's important. So I'd love to talk about any of those things anytime.
Oh, awesome. Well, so now that you gave me that invite and it's recorded, I'm going to use it.
There you go. There you go. Absolutely. Anytime.
Thank you so much. I appreciate it. And thank you to everyone who is watching this. As I said, it's time for us to take the step. We have to care. We have to care about our community, and we have to care about ourselves. And it all starts with just sharing that bit of concern and information. So we appreciate
if your listeners have concerned about something abnormal, you have this. You have my name. I'm at UNC Rex Pulmonary. Seek me out. I'm happy to come help anyone.
That's awesome. Well, we will be talking to you again very soon, because we want to continue having these discussions. So thank you. Thank you.
Thank you so much for having me. It was a pleasure.
Awesome. Have a good one.
Thank you.